Hi everyone, this is Adam Smetana, your insurance guru. I'm here to help you figure out how to get through the Healthcare.gov, get your application finished completely so you're all set. Again, making sure there's no loose ends on there, making sure it's done. You only have a certain amount of time to do this. You got to get it done by December 15th of 2018 to be set up for 2019, unless you have a special enrollment period, which we'll get into. And number two, you want to get the subsidy. If you qualify for a subsidy, you want to make sure the government's helping you pay for your coverage. So you want to make sure you got all of that, your ducks in order so that you do indeed get that financial assistance if you qualify. And I'm going to show you real quick how to make sure you do all that. It's a real simple process, but if it's your first time doing it could be a little bit intimidating. So I'm going to try to get through this as quick as I can for you so you got a real good idea. You're really comfortable about getting signed up here. So as you saw, we were just at the healthcare.gov. I just clicked on start a new application. Let's get started. So it's create a new account. Sometimes that part is a little bit slow during open enrollment. So you always want to, the sooner you start, the better. You never know about the website, whether it's going to be going really fast or really slow. So let's see. I'm just going to put this on pause until it starts working. So as you can see, we're right here back. And we're just going to, since, this part is not working right now. So it's always, the sooner you get this done, the better. You never know about these websites. There's probably who knows how many thousands of people on here right now. So but anyways, you're going to get here. Let's say you did have a profile, or everybody out there knows how to create a profile. It's really easy. So you're going to get to this point. You're going to go ahead and click on start a new application, probably, and we're going to go to 2019, Illinois. Let's see, just click in next. Lots of next buttons getting through. We'll go over the important stuff though. So here we go. Lots of privacy policy. Going over the addresses. Oh, actually, this is pretty important. If you did find this useful and you're not working with any other agent, please do. When you get after your contact information, it says help apply. If you tell us if you're getting help from one of these people, you can click agent here. You can put my first, last name, my organization, HST, Health Solutions Team. We have a website, check it out, and my NPN number. If I, in fact, do get a commission, I will certainly contact you. You contact me. We'll figure out how to send half of that money to a charity of our choice. And we're just going to be going ahead and moving forward here. Let's see. So just moving along. If you have a family, you'd obviously be adding people here. Let's go ahead and moving along here. Let's see. Am I a U.S. citizen? Sure I am. Let's put yes for that. Have you filed taxes in 2019? Sure have. Am I married? Nope. Let's see. So you just got a bunch of things to fill in, pretty self-explanatory. You don't have to answer that question if you don't want to. If you do have children, obviously you'll want to put them in here. They may qualify for certain, you may not have to pay for the coverage in certain situations. So make sure everybody in your house, you get down here. So normally we're going to go ahead and enter in your W-2 and all that sort of stuff. Sometimes your stuff will even come up already. So they kind of see a little bit here of my part-time jobs, and you want to make sure you get, let's see, based on what you told us, does this seem right? Sure, we'll put yes then. And let's see. So they have your total monthly income, and you want to be honest about this. You want to get it as close to what you're going to file in your taxes as possible. The reason is because when you do file your taxes, the IRS if you have a W-2 job, your W-2 job is telling the IRS how much you're earning. So you can't really get around saying, "Oh, I only earn this." Your employer already told them; they already took out the taxes, so you can't really lie about that. If of course, if you're self-employed or something like that, it's a different story. Just be real careful because. But you want to. The point is you want this to be accurate. You want to be able to prove it is what it is. If it's W-2 jobs, you want to put you want to be accurate. So we're going to go ahead and press save and continue here. Just going through the motions, of course. Now they're asking you some. They're asking you some certain. Now, if you need to do this during the year, it's not November 1st through December 15th. This is, all these questions they're asking me kind of is to see if you qualify for any of those other months: January, February, March, April, May, June. If you're answering yes to any of these, you will qualify. If you get married, if you end up having a child, if you lose your employer coverage, if you move to another county, if any of these things happen, you're going to be able to sign up in the middle of the year. But if none of them happen, only time you can sign up is November 1st through December 15th. That's why it's important to get this done as soon as you can. Of course, but of course you are going to have a chance of getting it done otherwise. So these are they're just going through all those, they call it SEP for short, Special Enrollment Period, the acronym. And there are time limits. For example, did you move in the last 60 days? Okay, that's 60 days. That's it. So make sure if you do sign up in the middle of the year, you're signing up, within a relatively short amount of time. I think if it's, I think if you lose your employer coverage, you only have 30 days. So that's a very short time actually when you lose your job. So let's see, they're just going through the basics here. Review application, save and continue. Whoops. Whoops. All right. So I guess I just got to hit continue for these. Electronically sign the application. Really simple. Just got to type your name in. Just going to hit view the eligibility report. We're moving along here. And soon we'll get to the fun part. Picking plans. Perfect. Okay, so obviously you do want to decide, figure out how much you're going to get. In my situation, based on your income, you qualify a premium tax credit of $188 a month. This is how much you can save on premium each month. It's not the amount of premium itself. So now, something important to know about this: if you do have if you think your income is going to go up next year, put down what you think you're going to earn next year, because if you just leave it the way it is, you're gonna at the end of next year, they're gonna say, "Hey, you earned this much money, but you said you were only gonna earn this much, so we're not gonna give you as much as a subsidy." And if you if you did pick a plan based on your subsidy, you're going to be disappointed when you see that you're not going to get your tax return back. They're going to keep the money that from your tax return to help offset those costs. So obviously, we're gonna go. You want to use all of it, obviously. You could click this, and if you're worried about that, you can just decide to get it when you get your taxes. Or if you're worried about losing out on that, you can change the amount. But I would just recommend you click this and uh, maybe go with a higher income. So you but it's up to you. You just have to know that. And had you used tobacco in the last 6 months? If you have, the rates are going to go up. So, do you have any prescriptions you take? Type them in. This way, it'll make sure it'll tell you whether or not it's covered with the plan you choose. Okay, so I use a low amount. I don't really use coverage very often, few doctor visits. But if you do use, if you have if you use health insurance a lot, you want to click this one because they're going to show you plans that are lower deductible, plans that are going to match how much you use here. So we're going to click on See All Plans, and let's go ahead and review that. So now, because let's see, because of my income, I'm going to qualify for something called extra savings. In the top left-hand corner here, you see extra savings, really important to look at. If you earn less than $30,000 a year, you should be able to find a plan for an individual that says extra savings. Okay. At this point, I figured I'd pull this up here. We're looking here at the 2009 federal poverty limit. So this is the number of people in your household. Let's say you are a family of two. If you're under this 20,580, it's actually, let me grab my calculator here. If you're earning less than that amount, in fact, if you're earning less than that amount, 27,000 with a family of two, you're going to qualify for Medicare. And in that case, you want to get in contact with your state. They're going to help you sign up for Medicare. It's free, which is great. That's what you want, probably. And if you do earn less than that, and you sign up for this, they're not going to give you a subsidy. So you need to get them. That's really what you want to do. It's actually 138,000. I'm 138% of the federal poverty limit, so that's what that is, 28,000. For a person of one person, you're on Medicare if you earn less than 21,000. Now, if you are under 250,000 of federal poverty limit, 37,000 for a male, you're going to qualify for like what I was telling you, the extra savings. So, or if you're family of two, 51,000, family of three, 64,000. So look at this chart. You can Google it or whatever. Screenshot it, save it, because if you are under 250, you do want to make sure you pick a plan with this extra savings. It's the yellow box here. Really important. The reason is you see this deductible right here, 2,625. Let's see. Let's take a look. This one is not. You see, there's no yellow box here. This one is a deductible of 7,000. What a deductible is, means that during the year, you need to pay the deductible before the policy kicks in. So you're paying $138 a month, and let's say you go to the doctor, and if you had some issue, you end up spending it's a $5,000 bill. They're gonna once you hit 2625, the health insurance company will start to kick in. Now, let's say if the bill was 10,000, they're going to help you as soon as you pay, let's say up to 63,000. If you spend $63,000 on your bill, they're going to help you cover. After you hit 2,600, they're going to help you pay for it. But once they're going to help you pay for it until you reach 6,300. Once you reach 6,300, then they're going to cover everything else. In this case right here, you can kind of see 40%. That means you're going to pay 40% until you hit 6,300. Once you hit 6,300 for the year, the insurance company cover everything else. So make sure about that. You want the cost savings. Look for it. Really important. That if you qualify, if you're under that 250,000 or 250 poverty limit. So, real simple. Let's go ahead and this is sounds like a good one. You might want to look and see if it's an HMO or PPO. Uh, HMO means it's a smaller network, so you might, and if you really want to see the doctor if you have a doctor you like, you have to probably check to see if it's in the network. If it's a PPO, more than likely you're gonna be able to, see your doctor, but it's not. You always want to check. So I don't really care what doctor I see. So if you did, you obviously have to click here, Dr. Smith, whatever you type in, it'll tell you. Otherwise, we're just going to go ahead and we're going to pick the cheapest one, click enroll. And would you like to enroll in this plan? Yes. So this is what, another reason to pick the cheapest one. If your income goes up, you're going to owe money at the end of the year. Are you interested in a separate dental plan? Sure, why not? Let's just move along here. So lots of other questions. I agree. So I'm going to stop here, but one thing you do want to make sure of is if you are earning, if you are getting a subsidy, they're going to want to make sure you're earning a certain amount of income a year. So once you're finished with all this, they're going to say, hey, we need to make sure you are earning that amount. Well, you need to send us some proof, or maybe if you're a green card holder or whatever, they're going to say, hey, we want to make sure you have your green card or whatever. So you need to make sure you do that. Otherwise, you're not going to be able to. They'll take the subsidy away from you. So you're going to get an email about that. You also want to look online, log back in line, and you're going to see notices. You're going to get emails. You want to call them, and you want to see that happens. So make sure that you call Healthcare.gov. You're following up. You're logging in. You're seeing if they require. See here, submit documents by deadline if required. If you're eligible, eligibility notice said that you have to send in documents. You must send the correct documents by a deadline. So if you don't, you may lose your coverage or any financial help you're getting. Visit application details for the list of required documents. So I'm just going to click here and see if I require any documents here. View eligibility results. So it's a PDF that's going to download, and you're going to, let's see what it says. All right, so here are the results. Next steps, choose a plan. You must choose a silver plan. You must choose a silver plan to get cost sharing reductions. So remember that yellow box savings that I was telling you about? That's what they're talking about. That's only on silver plans, only some of the silver plans. So look for that saving remark. That's important if you're eligible. So this will kind of tell you how to make sure you get your documents in, and it really is very important. So that's pretty much that. If you need help, if you want me to be your agent and help you with this, or if you're not eligible for any subsidy and you're healthy, give me a call. I might be able to find you a short-term medical plan, which is can save you pretty much a fortune. That's what I switched to for 2019. Or if you want to help signing up for a Healthcare.gov plan, I can help you do that too. So my personal number is 847-702-3281, 847-702-3281. And you're more than welcome to call me. I'm licensed. I can help you. I can help you pick out a plan, make sure it's the right one. Let's see. And please go ahead and subscribe to my channel. I also do health and life insurance, and I'm gonna get into property casualty. So do subscribe. I am an expert. I do know everything there is to know about insurance. So go ahead and subscribe and find out all those little details and um, shortcuts in the insurance industry, so I can help you save and get the best value for your money. Have a great day. Bye bye.